Hello, thanks for joining this webinar. We're very happy to be able to share some details today about how we can help families choose dental coverage on the marketplace in Kansas. This is Tanya Dorf-Bruner, and I'm the Executive Director at Oral Health Kansas. We're pleased to be working on this project with the Children's Dental Health Project in Washington, D.C., and have the support of Colin Roosh, who is the Director of Policy at CDHP. This is a project also undertaken with, in partnership with Cover Kansas, and is supported in part by the Kansas Department of Health and Environment with funding through their HRSA grant under the Maternal Child Health Services Block Grant. So without further ado, I'd like to introduce Colin Roosh from the Children's Dental Health Project.
Great, thanks, Tanya. So today I hope that we can provide navigator and consumer assistance personnel with the information and tools they need to help families choose dental coverage on the Kansas health insurance marketplace. Before we dig into the details in Kansas, I will walk through some of the basics of dental coverage under the Affordable Care Act, or the ACA, and then we'll get into some more specifics as to how that looks in the Kansas marketplace. So just some high-level background here. Dental coverage exists as part of the Essential Health Benefits Package, or EHB, and specifically under the ACA, children's dental coverage is required to be offered as part of the 10th category of essential health benefit services. So that's pediatric services, including oral and vision care. So all of these pediatric services are intended to provide a comprehensive benefit package for children and adolescents up to age 19 in the marketplaces, as well as through insurance offerings on the small group and individual insurance markets. That said, the ACA treats dental coverage a little differently than some of the other benefits in the essential health benefits. So comparing where we are now with dental coverage under the ACA to where we were before the ACA, there are a few notable differences. One, as I just mentioned, children's dental coverage must be offered as part of the essential health benefits and any insurance offerings that comply with the essential health benefits. The ACA also allows dental coverage to be subsidized through premium tax credits. It places some limits on out-of-pocket expenses for families. It also removes annual and lifetime dollar limits on dental coverage for children. So this is a big difference. Traditionally, dental coverage has had an annual dollar limit of $1,000 to $1,500 per year. So this really kind of positions dental coverage under the ACA as much more of a true insurance product compared to what we had prior to the ACA. Insurers are also required to offer child-only plans up to age 19, and it requires coverage of medically necessary orthodontic services in addition to other dental services. In addition to that, the ACA also establishes a whole host of preventive services that must be covered by health plans at no cost to beneficiaries. And that does include a few oral health services that are now sort of integrated into these medical plans. So jumping right into those preventive oral health services that must be covered by all qualified health plans. Number one is an oral health risk assessment by a pediatrician for young children, as well as referral to a dentist when problems are noted. Pediatricians can also provide fluoride supplements for children who don't have access to community water fluoridation. So this just ensures that they have adequate fluoride levels to make sure that their teeth develop as intended. And finally, a recent change in the last few years is that health plans must cover fluoride varnish application by pediatricians for all children through age 5 in accordance with the American Academy of Pediatrics Bright Futures recommendations. And again, these are services that would be provided or covered by the health plan rather than the dental plan. So in Kansas, as in every state, the benefits themselves are based on a benchmark insurance product that is already existing in the insurance market. So in many cases, the dental services are also based on a separate dental benchmark. So in Kansas, that dental benchmark is the Children's Health Insurance Program Plan, or Health Wave. So this covers a whole host of preventive and diagnostic services like exams, x-rays, fluoride treatments. It also covers your typical restorative treatments like fillings and root canals, extractions, gum disease treatment, as well as orthodontic treatment, emergency room services, and oral surgery. The other thing to note is that dental coverage can be offered in a couple of different ways. So as part of the essential health benefits package for kids, dental coverage can be included as part of a health plan. So the qualified health plan provides the entire range of services, from health services to dental services, or it can be offered separately. So a family may be purchasing a health plan that does not include pediatric dental, and then purchasing a separate standalone dental plan to fully round out that essential health benefits for a child. A couple of things to note with regard to standalone dental plans. They must be allowed to offer on the marketplace in Kansas. Qualified health plans have the option or prerogative to choose whether or not they include pediatric dental. So we see a mix of health plans that do and do not include dental coverage. But the ACA does not require the purchase of standalone dental coverage. So it's possible that a family might choose a health plan that doesn't include pediatric dental and exit the marketplace without purchasing standalone dental coverage. We certainly hope that doesn't happen, but it's important to make sure that consumers understand what their options are. And all of these offerings will differ based on the county or rating area that a given consumer is in. So how does this look county by county in Kansas? I'm happy to say that in each of Kansas's counties, and there are quite a few, there is at least one qualified health plan issuer that has plans that include pediatric dental. In all but Johnson and Wyandotte counties, that issuer is Blue Cross and Blue Shield of Kansas. In Johnson and Wyandotte counties, Oscar Insurance Company is the QHP issuer that has qualified health plans that include pediatric dental. With regard to standalone dental coverage, there are at least 3 standalone dental issuers in each county. So there's compared to previous years, every consumer should have the option to choose a health plan that includes pediatric dental or the option of a separate health and dental plan. So as I mentioned before, dental coverage isn't required to be purchased in the health insurance marketplace itself. So if they're offered through a standalone dental plan in that rating area, the qualified health plan issuer doesn't necessarily have to include that coverage in their products. But outside of the marketplace, in the case where a family is purchasing individual coverage sort of on their own, not through the healthcare.gov platform, the health plan issuers actually need to have reasonable assurance that their enrollees, including adults, have the entirety of the essential health benefits, including pediatric dental coverage. So people may be required to either purchase a health plan that has pediatric dental embedded in it or purchase separate dental coverage for themselves and their children. Another thing to note is we've seen the proliferation of additional insurance products outside of the marketplaces, like short-term health plans or association health plans. And one thing to make clear to consumers is these are not ACA compliant plans, which means that they don't necessarily have to offer the entire range of essential health benefit services. And so in many cases, we see these plans with limited or no dental coverage. And these plans also don't come with the same set of consumer protections that plans on the marketplace do. So this is just a quick comparison of standalone dental plans versus qualified health plans that embed or include pediatric dental coverage. So again, the standalone dental plans are optional to purchase, but as such, they do come with a separate that come as a separate insurance policy and a separate premium. There will also be a separate deductible and an additional out-of-pocket maximum on top of the qualified health plan out-of-pocket maximum. There are standalone dental plans on the marketplace that have both adult and child coverage in addition to the child-only plans. So some consumers may be looking for dental plans that cover both the parent and the child. So that will be outlined typically in the plan documents that are available on healthcare.gov. Some of the consumer protections may not apply to standalone dental plans in the same way that they apply to qualified health plans. For example, standalone dental plans don't necessarily have to provide access to a third-party appeals process when claims are denied. The other thing to note is that the cost-sharing reductions that are built into the Affordable Care Act, and these are for families up to 250% of the federal poverty level that helps reduce their out-of-pocket costs, apply to health plans or qualified health plans, but they do not apply to standalone dental plans. So when you're guiding or helping consumers make these choices on the marketplace, what are the things that you should be pointing out to them or helping them consider? We've got a few high-level things that I think are vitally important. One is the covered services themselves and what the cost-sharing structure is for those services. Out-of-pocket maximums and differentiating out-of-pocket maximums from deductibles. Obviously, premiums are a driving factor for any consumer. Again, cost-sharing reductions and whether or not those apply to the plans that a consumer is considering purchasing, and again, which consumer protections do or do not apply. So with regard to covered services, cost-sharing, and deductibles, the covered services for pediatric dental in the marketplace are essentially going to be the same across all plans because it's based on that state benchmark plan, the CHIP plan. So the same set of services is covered, but how the cost sharing and out-of-pocket expenses for the enrollee work out will vary from plan to plan. So, what you're expected to pay for a given category of services in and out of network will look different from plan to plan. Plans themselves, especially health plans, may differ in how they apply the deductible to dental services or specific categories of dental services. So, for example, some health plans may actually apply the entirety of the medical deductible to the dental services, and that can be a barrier for families who need immediate access to those dental services. With regard to out-of-pocket maximums, and this is the mechanism by which the Affordable Care Act limits cost sharing or out-of-pocket expenses. So the ACA sets annual limits on out-of-pocket expenses for essential health benefit services. With regard to pediatric dental in standalone dental plans, that out-of-pocket maximum is on top of the medical out-of-pocket maximum. So when you have a standalone dental plan, the out-of-pocket maximum for pediatric services will be $350 per child or $700 if you have 2 or more children. If the dental benefits are part of the qualified health plan, the out-of-pocket maximum doesn't change. It's still the same out-of-pocket maximum that you would have for a health plan that doesn't include pediatric dental. And again, I want to reiterate that the cost-sharing reductions for low-income families do not apply to standalone dental plans, but they do apply to qualified health plans that include pediatric dental. So this is just a graphic demonstrating exactly what I just said. On the left side, you'll see a health plan that includes pediatric dental as part of that product. This year, the individual out-of-pocket maximum is $8,200. And that covers both health and dental services. Whereas on the right side, you'll see a health plan that does not include pediatric dental with the additional purchase of a standalone dental plan. So you have that same $8,200 out-of-pocket maximum in the health plan, plus the out-of-pocket, the $350, or if you have more than one child, $700 out-of-pocket limit for the dental plan. So added together, the individual out-of-pocket maximum in that instance would be $8,550 in total. For consumer protections, there are a number of consumer protections that the Affordable Care Act put into place. Probably the most famous is protections for people with pre-existing conditions, preventing health insurers from denying coverage or claims for services. The ones that are most important here for pediatric dental are annual and lifetime dollar limits on that coverage, whether that's in a health plan or a dental plan. But there are a few consumer protections that don't apply to a standalone dental plan that do apply to a qualified health plan. So guaranteed issue or renewal, as well as the right to an external appeals process. And while protection against denials for pre-existing conditions does not apply to standalone dental plans, we haven't really heard of any instances in which a dental plan has refused coverage to someone with a pre-existing condition. So it's probably not a concern. Plans also must have adequate provider networks. So consumers who already have a provider that they like will want to make sure that that provider or preferred provider is in the service area or network for the plan that they're looking at. And the plans should be able to provide a provider list either through healthcare.gov or by reaching out directly to them. So here are a couple of examples that I pulled from this year's Kansas health insurance market. This example is a Blue Cross and Blue Shield of Kansas silver QHP that includes pediatric dental. So I pulled out the pediatric dental services and the cost sharing associated with it for in and out of network. And this is exactly the wording that they have. I just put it into a different table. So you get checkups every 6 months with no charge. Out of network, that's not covered. But what's worth pointing out here is that every other service is subject to the medical deductible. So this might be a barrier for a family that has immediate or high dental needs for their child and doesn't have a high level of medical need right off the bat, because they would need to pay out up to that entire deductible in order to access those dental services at that 30% out-of-pocket rate. Here's an example of a standalone dental plan. This one specifically is a Renaissance plan. I should note that when we look at the standalone dental plans in the Kansas marketplace, the average monthly premium for one child hovers around $30 a month. So that's relatively unchanged from years past. But it's worth noting that this is an additional premium on top of the health plan premium. So you'll also note that the way that these services and the cost sharing for these services is laid out is significantly different than what someone would see when they're looking at that Blue Cross plan on the previous slide. There is a lot more detail here, but it's also a bit more complicated because there is quite a bit more breakdown in what the out-of-pocket cost or what the plan covers. So for basic diagnostic and preventive services like exams, cleanings, fluoride treatments, the plan covers 80% in-network, 70% out-of-network. And then you get into a bit more nuance with regard to additional x-rays, minor restorative services, simple extraction, sealants, gum disease treatments, and other basic services. So you've got a mix of the plan pays 80% or 60%. And again, going down further into the more complicated services like oral surgery or major restorative treatments like crowns and orthodontics, you'll see that there's a mix of the plan paying 60% or 50%. So again, it's important that consumers take a close look at the plan documents that are available on healthcare.gov to see how the cost sharing or out-of-pocket expenses for them differ from plan to plan, including from standalone dental plan to standalone dental plan, as well as standalone dental plan to qualified health plan. And this is just another standalone plan example. So this is from Best One. and this is a slightly cheaper plan. And you'll again see a different mix and description of dental services. So there's no real standardization here in how the plans describe covered services. So it's really important to take kind of a close read of the different mix of categories and specific services that are listed under each category, as well as the expected out-of-pocket expenses. And you'll see that this one differs quite a bit from the last standalone dental plan. But they do tend to be a little more generous in some of the basic services, at least in network, and the cost sharing structure is a bit more simplified compared to the Renaissance plan. So just a kind of recap of key considerations for consumers and the consumer assistance personnel that are helping them. Again, all of the plans offering dental coverage on the marketplace for kids must offer the same services. But as we just saw, the cost sharing for those services and the way that those services are described differs significantly from plan to plan. It's also worth noting that plans that offer both child and adult dental services will have a completely different cost sharing structure for adult services, and those adult services will typically also have an annual dollar limit and may have an additional deductible that's applied. So for consumers that are looking to purchase dental coverage for both themselves and their child, they should be aware that the description of the child services does not reflect the same out-of-pocket or expenses or cost-sharing structure for adult services, because those adult services are not part of the essential health benefits. Every county has at least one health plan that includes pediatric dental. However, that's just one insurer in each county offering that type of plan. But there are multiple standalone dental options in each county. The consumers will pay additional premiums and have an additional out-of-pocket maximum for a standalone dental plan, in addition to the premium and out-of-pocket maximum that they have for their health plan. Every plan applies the deductible differently. Some health plans will be applying that full medical deductible to most dental services, and for consumers that have immediate dental needs, that may be a cost barrier for them to consider. The plan documents also vary when they're outlining dental services. There's a standardized form for qualified health plans that walks through different covered services and whether or not they're covered. So it asks about eye exams for kids, and it asks about dental checkups for kids. But unfortunately, it doesn't go into much detail with regard to dental checkups. So consumers will also need to click on the additional plan documents for that health plan to get a better understanding of the dental services and the cost sharing structure for those services. There is no standard form at all for the standalone dental plans, but each one does have a plan brochure with additional detail that consumers can review. And I will also reiterate that consumers may be seeing marketing for non-marketplace plans, such as short-term or association health plans, that do not provide the same coverage or protections as plans that are part of the marketplace or that are compliant with the essential health benefits coverage requirements. So assistance personnel might be asked about these plans, and they should be clear that these plans do not meet the ACA's requirements and likely do not provide the same level of dental coverage as plans that are available on the marketplace. So I hope that this has been helpful as you walk into this year's open enrollment period and are helping consumers understand the dental options that are available to them and their families. If you run into additional questions that I wasn't able to answer here during this presentation, feel free to reach out to me. My email address is right here on this slide, and I will do my best to answer your questions quickly and concisely. Thank you very much.